Today, I will walk through a consultation of diagnostics process at Clínica Ramírez, using the iTero intraoral scans, Align Oral Health Suite, and the new and very exciting Align X-ray Insights. So now let me show you and go through a patient with several dental conditions in the Align Oral Health Suites and also especially in the X-ray Insights. Again, we will go into the overview part, and here you will see the clicks. Let's go directly to the X-ray Insights. Software will connect with your X-ray database in the same platform. And here you will see all the information that your team has already taken from these patients. You will see some bitewings, we see the panoramics, and we see also some periapicals. Let's start out with the panoramic X-ray. Again, we click here, we see all this information. We will open radiograph here in this side. The radiograph will open immediately. And again, when you put this to a patient, they don't understand anything. Everything has to be explained in more detail. That's where AI start to help us for these initial communications. We have the option of changing the color if needed for more or less saturation. We can rotate the X-ray if needed. In this case, it's correctly done, so we don't need it. And now we're gonna press and show the detection. Here is where AI is at your fingertips. When you press here, and AI will start to give you information. So here we will have color codified everything that AI is helping us for diagnostics. We have red caries, we have orange periapical radiolucency, and a sort of loose for the part of the more restorative part. So everything will be easier to explain and to communicate with your patients. Of course, you can remove everything, the caries, the detections. You see here how the implant is also signed. You will have a chart here that will gonna help you in everything. And also you will have everything written here. So you will see by quadrant how everything is very well organized. If we go here, something is showing. You can see that we have the caries here. Let's take it out. You see a little bit here that is moving. And here you can see that something is detected. So this is gonna highlight, and the patient will understand that we might need some extra information in that tooth to be ordered to complete the diagnostics. One of the things that we can also show to the patient, like this green area, is the mandibular canal. The software is gonna show us the mandibular canal and the proximity to the roots of the patient, one area to the other. Then let's move now to the perio part. The perio part is something very useful because we can talk to the patient on how the bone conditions related to the root ratio is in the patient's mouth. Everything again will be color codified. So for the patient, it's also very nice to understand this part. We normally always want to be around in the gray area. So if we go, for example, for the central incisor, we can take to the patient, this part you have 13 and 14% of bone loss in the mesial and distal part. But if we go for a more posterior parts, like in these areas, everything is moving slightly into the orange zone. So we can explain to the patient that we want to keep this area with more perio control. And of course, we don't want this to be changed in the future for more areas of bone loss, that everything can be a little bit more compromised. So again, you as a doctor will be the one that have to double check and be sure that all this information is correct in order to generate a correct treatment plan to the patient. Now here, when you have everything set and you have already confirmed what's going on in the patient's mouth, you can confirm and generate a report. This will be a PDF with all your notes that can be shared to your patients, in this case, with the panoramic X-rays. But now let's go and see the other information that we have with these patients. Let's start with the bitewing of the fourth quadrant. We're gonna open, and again, when the patients see this, they don't understand so much. They will see something gray. But if we again press the AI button and start to show detections, and you see that how something is happening in the patient's mouth, this will be highlighted. Caries in this part that the patients can see that something is going on under the feeling that the patient has. If we click in this part, You can see how this gray zone is a little bit more marked. Again, you as a doctor will be the one that has to double check and confirm that this is clinically happened. But this again is going to help you. You will do the test that you need. You will do the clinical explorations. You can also hide the filling and see the only possibilities of the caries. You can also press some of the high sensitivity areas. This means that this area is going to be more confirmed by the software that something is going on inside on that part. And you will later on confirm that this is really happening in the patient's mouth. Let's go back now and see the other quadrant. Now here you can see on a bitewing, when we're going to press show detections, how AI is going to help us to again communicate with the patients and see the feeling that the patient has. But another tool that is very nice to share and also that help us for diagnostic is the high sensitivity tool. If we press here, the software will try to be more precise in some areas that might have some areas that will start with some caries. Nowadays, with needed technology, we'll also combine both technologies to have the final information. In this upper part, you can confirm or not depending on your clinical diagnostics. So let's confirm here that we truly believe that is something happening there, but also to be sure and also check in the next appointments, we can put some notes in this area. Check interproximal. And we can add this note that will be codified into this patient's in particular tooth. When we confirm and generate the report, these notes also will be added here so the patients can check the notes, and it will be very helpful for us also for future communications and planning with these patients. After everything is checked, we will go back. And again, we can, in the same platform, start again our journey of communication with the Align Oral Health Suite. Very important, everything is in one platform and you have all the tools to communicate with your patient plus diagnostics in terms of in case of X-ray insights.